Across the country, more Americans are facing rising costs,
The grocery prices are like everything else. They're in a bad state.
loneliness, and uncertainty over where to turn for support. And it's not just about making ends meet. It's affecting our mental health.
Everyone's trying to figure themselves out.
5 years since the global pandemic changed our world, its ripple effects are still impacting our basic needs, emotional security, and connections with others. But you are not alone. From coast to coast, we are also finding stories of hope
I am doing so much better. There's a prettier smile on my face.
and solutions making everyone's life a little brighter.
Your mental health is your everything.
The state of mental health in America starts right now. Here's something that's not always talked about: the state of mental health in America. I'm Dr. Nicole Clark. I hope something said during our time together informs you, inspires hope, and makes life just a bit more manageable. To help you do that, let's start with this triangle. It's part of psychologist Abraham Maslow's hierarchy of needs. It is also our roadmap for the next half hour. As a therapist, I use it to break down the needs we all have. Our most basic need is for food, clothing, and shelter. Then we seek a sense of security, including emotional security. After that, we pursue love and belongingness. Let's start with our basic needs and how they have been challenged. Over the last 5 years, rising costs have made it harder for many people to obtain essentials. In 2020, more than 38 million Americans faced food insecurity. That's about 1 in 10 of us. In the most recent data, that number jumped nearly 24% to over 47 million people. Also, more people are experiencing homelessness. Last year, the U.S. saw an 18% increase in people without a home as compared to the year before. On top of that, more than 7 million people are looking for work, according to the latest data from the Bureau of Labor Statistics. These are the facts and figures, but the real question is, how are everyday Americans doing? How are you doing? We hit the streets and asked that question. Here are some of the responses.
Hi, my name is Alyssa Descartes. Kiara Graham.
Stephen Sherman,
Yasmin Lyons.
Vicky Cronus,
Zanaya Nobles.
Zaire Cruz, Jacob Manzanera.
My name is Christina.
If I can be honest, I think that the current state of politics has way more to do with people's mental health.
It's impacting how we think of ourselves. It's impacting how we show up for ourselves and other people.
I know several people, that have been a part of political divides, family members that cut each other off, even though they've known each other for years.
It has been bad. They making all these food prices go up and stuff. I feel like of me getting older, I'm really gonna have to make money. So it's really a lot of stress. I don't like to talk about my feelings. Yeah, that makes it hard.
At least my generation, the Gen Z, they're doing pretty bad. But if you actually speak to someone, they put a persona, like they have a facade. But truthfully, if you get to know them, this smile that we have is just not who we truly are.
We hear you. We are dealing with some real concerns, from political disagreements, regardless of who you support, to affording food these days, to juggling it all while saying you're okay. All of that can take a major toll on your mental health. Former U.S. Surgeon General Dr. Jerome Adams shared his perspective with me. It's a path towards better mental health through building connections with others.
We have to understand that mental health does not exist in a vacuum. It's impacted by your physical health, and it impacts your physical health.
What would you say is the current state of mental health in America?
I think it's important that we understand that the state of mental health is concerning, to say the least.
Many mental health professionals and researchers say a number of Americans who may have symptoms or concerns regarding their mental health may not even recognize it. Where do you think that disconnect lies?
Education is an important part of this. Mental health problems disproportionately affect certain communities, so we see these problems of stigma disproportionately impact, for example, the LGBTQ plus community, which faces significantly higher risk of suicide and mental health issues. Minority communities, especially Black and Latino populations, experience poorer mental health outcomes. And then finally, youth are increasingly struggling with mental health challenges. 1 in 3 adolescents report symptoms of depression and anxiety, and that is a shocking stat to me as a father of 3 teenagers.
What gives you hope, and what would you say is the path forward?
I think it's important for parents to make it normal to talk about mental health around the dinner table. And like I said, not from a deficit standpoint, not from a negative what's wrong with you standpoint, but from a how are things going? What gives me hope are our young people. Our young people are far more likely to talk about their mental health, to say I need a timeout, to really talk about it in a way that we need to be discussing mental health. We often, when we're talking about mental health, we really in our minds are thinking about mental illness. We're thinking about one end of the spectrum. But we want to ask ourselves not just how do we recognize, diagnose, and treat problems, but how do we promote mental wellness? And we do that by building healthy societies where people feel like they aren't isolated, where they feel like they've got friends, where they feel like their basic needs are met. And those basic needs are food, water, shelter, but it's also companionship. And so if we can build healthier communities, then we'll have more people healthy from a mental health perspective.
Now let's unpack that advice. By building healthier communities, we can create a healthy America together. But that's a challenge, especially when the Substance Abuse and Mental Health Services Administration reports more than 60 million Americans are living with some form of mental illness. And about 20% of them also battle a substance use disorder. I spoke with Dr. Arthur Kleinschmidt, who was recently appointed by the Trump administration to lead SAMHSA. In his first network interview, Dr. Kleinschmidt told me investing in people is the path to building a stronger society.
Everybody is capable of finding recovery and living a life of joy. I've done a lot of family counseling in my life, and I just want them to be left with the idea of hope. That, like I said, nobody's too sick to recover. We can all do this thing, especially if we start working together.
So how do you make that connection toward better mental health? One woman shares what she's doing to help her clients get the support they need.
I build a bridge with community to the mental health resources. Your mental health is your everything.
We have to take a quick break, but first, if you or a loved one needs support, grab your phone and take a picture of the resources here on your screen. You can also scan the QR code for more information on our website. The State of Mental Health in America continues after this short break. Welcome back to the State of Mental Health in America. In many cases, the path to feeling better starts with our own actions. Here's how some of you take care of yourself.
Letting people know that it's okay to speak out when you're not feeling right, or you search out for help. Don't keep it all bottled in.
I focus a lot on physical health, exercising, spiritual health.
Trying to interact with different types of people, trying to get outside more, trying to stay away from being isolated.
I like playing with my dogs, I like listening to music, just doing therapeutic activities after work.
As I'm navigating, my adulthood, I'm trying to figure out what is the good balance. Going to therapy, that is a good balance, right? Having a good support system.
It is also on mindset, and it is a willingness to keep on learning and become better.
Everybody's going through something. So if we could all just give each other grace and give ourselves some grace, especially in these trying times, I think we'd all be better off.
Enjoying the outdoors, listening to music, spending time with loved ones. That's how many of you told us you care for your mental health. Let's go back to Abraham Maslow's triangle to understand what's really going on. It has to do with this section. What you're doing in those moments of self-care to build a greater sense of emotional security. That's one's feeling of stability and confidence and the belief that your emotional needs will be met and respected. We have seen a significant rise in people recognizing that they need emotional and mental health support. It's what NAMI Chief Medical Officer Dr. Ken Duckworth calls the unintended consequences of the pandemic.
So many people were impacted in terms of anxiety, depression, increased substance use. I think more people were willing to talk about mental health, and mental health went from a they thing to a we thing.
Did you hear that? From a they thing to a we thing. The challenges of the pandemic brought people together, pushing us all to be a bit more willing to speak out about mental health. While this has helped chip away at the stigma, it has also exposed a growing challenge: finding mental health care. More than half of the U.S. population lives in an area with a shortage of mental health professionals. The average wait time for services is 48 days. Adding to the challenge, the fact that more than 27 million Americans are uninsured and often face significant financial barriers to getting the help they need. So what do you do when you need help, but that help is out of reach physically or financially? One woman has walked that difficult road herself.
Being of the African American community, this is so taboo to talk about mental health. I am Aisha Gooden Williams. I am a mental health advocate and a mental health coach. And what I do is I build a bridge with community to the mental health resources. Your mental health is your everything. It's a part of my purpose now, is because my mom was bipolar and schizophrenic. And later in life, I had to deal with the childhood trauma of the effects of what we went through as children. This is a picture of my mom at the state hospital. This is me, and this is my twin sister, this is my older sister, and this is my mom. I couldn't remember this moment because I was a toddler, but I remembered how the state hospital looked. I remember the times my mom was there and we couldn't see her, or we didn't understand what was going on. But if I would have had access to more support, and also having the answer to what sick was, because that's all I heard was my mother was sick, but nobody could tell me what the sickness was. So because of the limited access, I have decided to be a bridge. I have decided to be able to openly share my story so others can know that there's still hope out there. People do not even know how to make the proper call when it's dealing with mental health. I rebranded my salon. I added the wellness part, the mental health part, and partnering with licensed professionals I can send my clients to. Since it is so hard to sometimes get into places, leading them in the right direction so they won't give up. Oftentimes their access is limited, their funds are limited, their insurance is limited, so we want to make sure we send them to the proper places, because we do not want people to give up, not lose their identity. When you're in the middle of a mental health crisis, sometimes you don't even recognize yourself. It's important to me, and it feels so good to me to see somebody get their life back.
We want you to know there is hope. And after the break, we are taking a closer look at how people are doing more than just finding it. They're developing a sense of belonging.
To create systems to support people outside of the clinical setting. And that means working with coaches and faith leaders and parents and schools to have the conversations, provide the connection and support.
If we're being honest, we've all felt lonely at one time or another. In fact, loneliness has become a quiet epidemic, leaving about 1 in 2 Americans feeling disconnected and unseen. That's because based on this hierarchy of needs, we all need to feel love and that we belong. That feeling combats isolation and loneliness. We all yearn for connection, and to find it, people are turning to everything from apps to running clubs. When Mallory Kilmer moved to Hudson Yards in New York City 3 years ago, she was fulfilling a lifelong dream.
It was just like an immediate, this is where I need to be.
But there was something missing, a sense of community.
You feel really alone because no one just goes up to someone in the street and is like, oh, I want to be your friend. Like, that doesn't happen.
Mallory is an avid runner, so the content creator took to Instagram, posting that she'd be in Central Park that Saturday morning if anyone wanted to meet up to run.
And I was like, oh my gosh, what if no one shows up? Putting yourself out there to meet people is terrifying.
6 girls came to that first meetup. 2 years later, hundreds continue to show up each week. And the club, appropriately named No More Lonely Runs, has around 9,000 members globally.
I have met some lifelong friends, people that I'll hang out with on the weekends now.
I can't imagine in 10 years not knowing these people.
Finding meaningful social relationships is vital to both our mental and physical health, according to psychiatrist Dr. Daniel Knuffelmacher.
In 2023, the U.S. Surgeon General released a report on what they called an epidemic of loneliness and social isolation.
The research found that lacking social connection can increase the risk of premature death as much as smoking 15 cigarettes a day. Our social connections have been fracturing since the mid-1970s when more people started moving further from family and friends. The COVID-19 pandemic further exacerbated the problem.
And that was a spike, but I'd say that a lot of that has lingered after.
We were so isolated for so long. Then there's technology. We feel so safe behind our phones.
But technology may also lead to meeting new people, like when Mallory posted about her run club.
You're not going to meet your people on your couch, in your apartment, in your home. You have to actually put yourself out there and go there.
Sometimes all that's needed is to take the first step. Remember, hope floats and joy can come after loneliness. And we have just the story to prove that. Last year, Allison Christopher reached out to share her very personal mental health journey with bipolar disorder, explaining the strong feelings of not belonging that she experienced because of it. But today, Allison says she's thriving.
I am doing so much better. There's a prettier smile on my face. My hair's even growing back. You know what I mean? So I'm making changes to me.
I got to get all of this information. There's a lot of newness here. Allison, okay, I just need to break it all down. First, let's go back a little bit. When I last talked to you, you expressed to me that, there were some struggles because of your diagnoses. You said it got so bad that you thought about ending your life. And you were telling me today that you are no longer in that place?
I'm no longer in that place.
What changed for you between a year ago and now?
I started writing because what journaling does, it actually lets you know these are my feelings. This is what I feel like on a daily basis. Now I have a more projected way of thinking.
You are an example of someone who has a health condition, but is not allowing that health condition to dictate how you live your life.
Anyone that's enduring a mental illness or anything they feel that they're different or going through any type of struggles, realize everyone has something that they're going through. It doesn't always have to be the stigma of bipolar disorder. So all these things show you that you can live, you can play and still have a strong mental background.
Hope, the belief that something positive will happen, is a powerful word. As a therapist and a journalist, you living your best life possible is my personal hope. As we look forward to what the future of mental health in America looks like, here's what some of you are hoping for.
My hope is that particularly young adults, as they are navigating life into their, early 20s, into their 30s, that they sit down and assess their life.
I just hope that we can change our mental health and just become more positive going forward in the future and be more kind and loving to each other.
We have differences in opinions and just accept one another. The faster that we can accept that as a society in America, the better off we'll be.
And it's okay when you're not okay. Like they say, if you're not okay, it's okay. Because a lot of people going through it.
We should all hopefully want to take our mental health seriously. We all need help. It's okay to not be okay. So take care of your mental health. If I can do it, you can do it.
Thank you so much for watching The State of Mental Health in America. I'm Dr. Nicole Clark. Take care of yourself. Be kind to one another. You never know when someone is going through something. And remember, we are all in this together. You are not alone. You don't have to suffer in silence. Goodbye for now.
Thanks for watching our YouTube channel. For more stories in your community, click the subscribe button here. You can also download the Spectrum News app or watch us on TV for the latest information, balanced coverage, weather updates every 10 minutes, and more. We'll see you then.